What does it look like when a clinician decides that fixing teeth is not enough, but fixing the way dental practices operate is just as important?
So when I tell my story to my friends here, they would be surprised. So you didn't choose dentistry? I was like, no, actually dentistry chose me. So I went to them and I asked them, I want to give an interview. And they were like, you don't even qualify. Everybody was getting done within 15 minutes and my interview lasted for 1.5 hours.
So, if you could give your younger self one piece of advice about business, what would it be?
Remember, every outstanding success is based on the ability to do better than just good enough.
Welcome everyone to the Dental Lens. What does it look like when a clinician decides that fixing teeth is not enough, but fixing the way dental practices operate is just as important? My guest today has made that question the center of his life's work. Dr. Vajahat Yar Khan is a dentist, entrepreneur, and innovator on a mission to make every dental practice easy, efficient, and profitable. He operates at a fascinating intersection where quality clinical care meets business transformation and where artificial intelligence works alongside human intelligence rather than replacing it. He calls it an ecosystem of AI with humans, and it's a philosophy that's shaping how he builds, consults, and leads. Whether you are a practice owner drowning in operational complexity, a clinician wondering whether there's a smarter way to build a sustainable career, or someone simply curious about where dentistry is leading, this conversation is going to give you a lot to think about. Please welcome Dr. Vajahat Yar Khan. He is a board certified periodontist and the CEO of Denttracks.
Thank you, Dr. Zaidi. It's Denttracks. It's basically a platform which tracks everything that happens in a business operation. So I came up with this because it's something that relates to dentistry, and it's like when we began building it, it was like a tracking type of a software, and then we transformed it into something that is autonomous now. So yeah, it's Denttracks. Glad to be on your show. I've heard really good things about your show, and it it has a lot of followers. So congratulations on this journey that you have made yourself to.
Thank you so much. I think it's incredible on your guest parts also for coming onto the show and sharing their stories. So, sir, I have gone through your LinkedIn profile and I realized that you are from Nagpur, India.
Yeah,
Yeah, and you are now in
Houston, Texas.
Houston, Texas. Yeah. So, sir, I have seen your journey from India to Houston, Texas. So, can you share about how the journey has transformed you?
Yeah, so I've lived most of my life before I came uh, out of India. Most of my life was in Nagpur. So I went to school in Nagpur. Then I went to my junior college in Nagpur. Both of them were SFS, St. Francis D. Sales High School, and then the junior college. And then, you know how it happens in India. Um, I was pursuing a career in medicine, and I missed it. So my marks were 1 point less than what I could have had to be able to get into a medical school. So the next best option was dentistry. So when I tell this story to my friends here, in United States, people pursue their careers early on in their lives, and they just continue to pursue it until they reach it. Most of the times, I mean, people who are dedicated to it. So when I tell my story to my friends here and my co-residents when I was doing my residency, they would be surprised. So you didn't choose dentistry? I was like, no, actually, dentistry chose me because I missed my medical school. So the next best choice was dentistry. And that's how I got into dentistry. I went to a great dental school, one of the best, I would say, Government Dental College and Hospital, Nagpur. It was 30 people in our batch total. It was a very, very small class at that time. Now they have 100. And, I was one of them. So that journey taught me a lot. Those were difficult days because my father passed away when I was in 10th grade. You know how it is without being able to have the support to be able to, go into a professional school. but Government Dental College and Hospital Nagpur, it was a state school, a government school, so everything was paid. In fact, you got paid to go through your education. So I'm really grateful to such kind of a setup. You will not find such a setup in the United States, in many parts of the world. So our government, our setups in India, the institutions that are there, allowed people of merit to be able to pursue their careers, and it's a great thing. So from there, once I finished my dental school, I joined a private practice while I was in internship, like a lot of other people do, and then I started my first clinic in Nagpur, in a place called Ahbab Colony, Jafar Nagar, and that was my first undertaking. So I didn't wait for too much of a time to just continue to work for somebody. I was an entrepreneur right from the beginning. I always thought that I would do well with the business. So I started my own dental office. Now that dental office had just one chair, like it is in most of the dental offices in India. And then it picked up. It was in a nice area, and then we started getting busier. Now my brother is also a dentist. He is in Nagpur too, and when he graduated, like 3 years after I graduated, he started working with me. We are brothers, so he was like, okay, I have a ready setup, so let me go ahead and work with my brother. So we started working together, and then how patients are. Patients are like used to you, then they want to see you. We as dentists are our own brands, unfortunately and fortunately. Um, but when patients used to come to my office, I mean, they would be like, we only want to see Vajahat Yar Khan, not Shabahat Yar Khan, because I'm the senior dentist. So he would see less patients, and he started getting worried that, okay, what would I do? Because patients want to see you. I will not get enough experience. So he started thinking of joining another practice. Then what happened was, I had a friend, Dr. Mujib Ashrafi, and he and I were very close. He got a call from a recruiter that was recruiting for Saudi Arabia Ministry of Health, and he decided to take me on that interview. I mean, he insisted, no, come with me. You will have experience and we will have fun. So we decided that we will, okay, go together. So I went with him. I only had like less than 3 years of experience at that time, and they wanted people of 3 years or more experience to interview. So when I reached there, I decided that I'll at least ask them. I just went ahead. It was called Al Hind something. They were the recruiters. They would bring people or delegates from Saudi Arabia and plan, and they would have these interviews. So I went to them and I asked them, I want to give an interview, and they were like, okay. They looked at my credentials and they were like, you don't even qualify. I was like, okay, I know I won't qualify, but can you just allow me to do an interview, because I want to just have the experience. So they discussed among themselves and they said, okay, we'll get you in. So I got in. And then when that interview happened, my interview lasted for 1.5 hours. So everybody was getting done within 15 minutes, and my interview lasted for 1.5 hours. So when I came out of the room, Dr. Mujib Ashrafi and I had another friend. They were like, what were you doing inside there? You were there for 1.5 hours. I don't know. I mean, I was just presenting my cases and I was doing the interview. I got a call within 1 week that you're selected. So I got selected, and I spoke with my brother. I said, I just went there. It was something divine that happened. You were complaining about this. So now here is the key. You can take care of the office. Now patients don't have a choice. This is your office. So I just went to Saudi Arabia, and then I worked there for Ministry of Health for 3 years in Saudi. I was in an area called Abha Khamis Mushet. I don't know if you know that area. It
Yeah,
was in Asir province, southern part of Saudi Arabia. Very beautiful place. Uh, Saudi Arabia is known for its heat, but
yeah,
while living there for 3 years, I never experienced heat because it was a hill station. It was really, really pretty. So I spent 3 years there. When I was there, first year, I realized that I want to do more. I want to study more. And what better place to go for your advanced studies than United States? So I started pursuing that career. I wanted to go and study. So I started taking books and notes, and I started studying. And first year, when I got my first vacation, I applied from Saudi Arabia for a visa to US to be able to take my national board dental exam. It used to be in 2 steps at that time.
Yes.
They just changed it to a comprehensive 1 step. So I studied and then I applied. I got the visa, and it was a visa for only 15 days. I flew to the US and I took my national board exam part one. Second vacation I had, I took my national board exam part two. At that time, I got a visa for 6 months. And once I finished my national board part two, third year when I had my vacation, I came again. At that time, I got a 5 year multiple visa. And then I started interviewing. I interviewed at 15 different places. And after that, it was like a rude awakening. I did not get in. After giving 15 interviews, I wasn't able to get in. And I was really disheartened. I lived here long enough. I lived in the US at that time for 3 months, stayed at a place of my friend. He lives in Dallas, Texas. And then, I just tried, and I wouldn't get a position. So I was so late that my Iqama got cancelled in Saudi Arabia, and I did not have a way to go back either. So I was stuck, and I had to go back to India. So I thought, okay, what would I do now? Because I don't have a job, I don't have a position landed in the US. So I started studying for something called as GRE, because then I thought maybe it's a better thing for me to just get into a non-clinical field and then maybe pursue something from there after I'm into the MS program. So, anyways, I started studying for GRE, and in about 2 months, I got a call. I got a call from UMKC, University of Missouri, Kansas City, for an oral and maxillofacial radiology program. So I took the position and I came to the US, um, and I got a student visa. This was in 2003. So it was a 3 year program. I took that position. In the first year, I had something called as general practice residency. So I was practicing general dentistry as a part of the program. And while I was doing that, I realized that, I really don't want to do radiology. So then I started applying for core clinical fields. I applied for all the fields. You know how it is. Like I told you, what it was important for me was to get into a clinical field. It did not matter what specialty I took. Then I got a lot, because I was in their system now, I got a lot of calls for different interviews. I got like 5 or 6 calls, and it was endo, it was prosto, it was perio, pedo, um, GPR for a 2 year program. So I gave all the interviews. I was waitlisted in a few, and then I got a position in pedo at Louisiana State University in New Orleans. Uh, I was not going to be waiting, so whichever one got me in for sure, I just took it. And then pedo was something I realized that in India, whenever you were practicing or whenever you were learning and doing your internships and house jobs, they did not teach a lot of pedo. And pedo was something that was really, I did not know a lot. So I thought this is a great field, general dentistry. I know a lot. I was doing everything that I could do, including surgeries and molar endos and all of smile designing, everything I was doing. Pedo, I wasn't doing much. So I thought, okay, this is great. I'll go into pedo. And I took that position. So this was in 2004. I got into a pedo residency. I completed my GPR, left my radiology program, and then I took a position in pedo. So when I was leaving my radiology program, my program director was a little upset that, I was leaving in the middle of it. So I spoke with him. I said, I know a lot of people who are really qualified, so I can line up interviews for you, and maybe you'll be able to fill the position. I'm sorry I am having to do that because I really want to be in a core clinical discipline. My heart is there. And he understood. People over here, they're very understanding. So then he allowed me to, send messages to a bunch of people. So do you remember I told you in the story, Dr. Mujib Ashrafi was my friend, and uh, with him I went to interview for Saudi Arabia. So I put his application in, and he got in there. So he got into a radiology program, and then he substituted me. I went to LSU for pedo, and he's here with me today. And he's in Houston, and he practices. He has his own practice. So that's how I got in, and I finished my pedo program. Uh, if you remember, I don't know if you're aware, but in 2005, there was a big storm here in the US which hit New Orleans really bad. It was called Katrina.
True now.
It was a
Yeah.
Hurricane Katrina. So I was there in New Orleans at that time. So I was in my second year of residency. My wife was about 7.5 months pregnant. We just picked up our cat. We had a cat in our house. We picked up our cat. I picked up my credentials, two pair of clothes, and we thought, okay, in 2 days we will be back. Um, Katrina was so bad that we were not able to come back for 6 months. So when we were leaving New Orleans in the car, the traffic was so bad. The route was only 4.5, 5 hours. It took us 18 hours to reach Houston, and the traffic was only moving in one direction. So that's how I ended up in Houston. I did not have a plan to be in Houston, or live the rest of my life here in Houston, but that's what happened. This is the qadr. This is
God's
the
plan.
doing of Allah subhanahu wa ta'ala, that this is what happened. And then I ended up in Houston, and I did not have a position because my position was in New Orleans. So
Yeah.
I went to the dental school here in Houston, and I spoke with the program director, and I told him everybody knew the story, what was happening in New Orleans. So I asked him, is it possible for you to absorb me as a visiting resident here? Do something about it. So, they talked amongst themselves. They spoke to my program director, and then they were able to create a position for me as a visiting resident for a few days till the program opened up over there. Well, what that did was it created a precedent for other residents. There were 6 other residents, and everybody got in different programs. Everybody got absorbed as a visiting resident. Somebody in Baylor, somebody in University of Mississippi. There was a girl in Boston who got accepted there. So everybody got a position, and we were able to finish in time. So they tell me that they call me VJ. It's difficult for them to pronounce
Yes.
my first name, Vajahat. So they call me VJ. VJ, you are a trendsetter. You helped us get a position in other schools. So this is what happened. And then I went back after 6 months. I finished up. We had our first baby. I finished up, and then um, when I was finishing up, I got a letter from UT, University of Texas at Houston, that we are looking for a faculty. We know your work ethic, and we know how you work, and we really enjoyed you being here as a visiting resident. We want to offer you a position for a faculty here. I just took the position in a heartbeat because I really loved Houston. My wife loved Houston, so I just took that position as a associate professor at UT Houston. It was a 10-year position where I had a track to be a professor. Then I worked here 3 years into that position. I realized that the university was not willing to do my green card process through the track that I wished they would do. Then I decided, okay, I should change and get into private practice. In 2010, my visa changed into something that I could do private practice. And I started my first practice in 2010. And from 2010 to now, 2026, it's been a journey. I have 12 practices. in Houston metropolitan area. I have a platform called Denttracks, and I have a managed services business that provide back office operations services to the dental offices in the United States. I have a team of 350 people in India that help those offices do the running billing services and other back office services. And this is all history. So this is the story.
It's such a fascinating story, and I was completely absorbed and how the serendipity worked for you coming to Saudi and then US.
Yeah. So I mean, it's a journey, and I
Yeah.
have a lot of small stories within this journey.
Hmm.
But what I can tell you is, there are a lot of good people in the world. I want to tell the viewers that there's so much wrong happening in the world, and we focus a lot on that. But what I believe is, the world is running because of the good people that are in it. Along my journey, I can have counts of so many people that have like bailed me out in different situations, that have helped me in my career, that have helped me with finances, that have helped me in helping me learn. I was a new person in this country. And another thing I wanted to say is, like, this is a really, really great country. If you have merit, if you have a proper way for you to succeed, and you have a plan and you're working towards your plan, it's really great how people over here acknowledge the merit in a person. They acknowledge the hard work that a person is doing, and you can just keep progressing. I mean, you're creating jobs here, you're creating an environment for people to work and be a part of your team. I have a big team over here. I have about 125 people that work with me for our organizations. In India, I have about 350 people working. So it's a great feeling to be a part of something where people have joined, people are helping each other, and it's a wonderful feeling. And all praise to Allah for being able to give me this opportunity, and helping me be something where I did not even imagine when I was going through the hardships of early life after my father passed away, that I would be in this position today. So just for viewers who are struggling, working hard, and trying to find their niche, trying to find their spot where they can succeed, just be just persevere, just be hardworking, and then continue to progress in what you desire for and what you dream for, and things will happen for you. That's my message.
Yeah. Do you still think, there is a scope for dental professionals coming now to US?
Well, things have changed in the term that the visa restrictions and all the geopolitical situation that's going on right now, that has really changed things in a lot of perspectives. But like I said, merit has a lot of value here. So you can try. I mean, keep trying, because at the end of the day, it's the university that will write you a letter. It's the university that will bring you in. So if you really have the talent, if you've done something which creates a value, when universities see that you have it in you, then they'll send you a letter, and that letter is what you take to the consulate. And if you get a visa, then you're in. Once you're in a university setup, there's a lot of value that you can create for yourself while being in the educational setup over here, and rest of the things can follow. There are still very good programs, very good plans, and green card processes that can still have a fast track for that process for you, if you are really qualified and meritorious. So I would say, yeah, definitely pursue if you have the desire to do that, and hopefully, you will get in.
Hopefully. I think it's a beautiful story who wants to, do a lot of things in life. And apart from this dentistry, you're also doing business of both BPO, and now you have launched Dentracks. I think it was started in 2017. So, while running a busy pediatric dental practice and a PPO company, when did you decide to build Denttracks?
Yeah, so that journey is fascinating too. So I have when I started my first practice, I was busy. Like, I mean, I bought it from an older pediatric dentist, and I was working as a faculty in UT at that time. And I had a colleague, Dr. Freddie Cisak. He was an older gentleman, and he always told me, like repeatedly, he would tell me, Vijay, what are you doing in a university setup? You're so talented. You're such a good clinician. You have good mannerisms. You have good command over the language. What are you doing here? I mean, this is for old people, people like me who are done with their careers. I want to give back to my profession, um, or if there is some kind of a problem with a person that they cannot practice. So I was like, I enjoy doing this. But he was like, no, you should get out, get your hands wet. You should, be outside and practicing. So I said, Dr. Cisak, I have another issue. I said, I don't have the money to start my practice, and I don't want to get into any kind of loans because I don't believe in paying an interest, and that's my faith-based thing, and I just don't want to do that. So he was like, okay, let me introduce you to my friend. He's trying to sell his practice. He's not able to sell his practice because it's really old, but his practice is very good. I was like, okay. So he introduced me to Dr. Jerry McGowan. He he was 72 years old at that time, and he was still practicing. And when I met him, I liked his practice philosophy. And then I told him I have this limitation. I will not get a bank loan. So he said, okay, I will finance your practice. I will finance it at 0% interest. You can pay me over time. So, that clicked with me. Then I did further discussions. I explained to him about my visa situation. People here, like the common people here at that time at least, they did not understand what all that meant, visa and all of that. So first thing that comes to their mind is, are you illegal? I was like, no, I'm not illegal. I'm the cream. I'm the cream. Like, I'm the top 5% from India that got a chance to come to the United States, and I'm the cream of the crop. So I had to like sit down five different attorneys who were discussing, okay, how this is to be done, and then that convinced Dr. McGowan that this is not something funky, and this is something that happens in the real world. And he understood that this is a person who's very, very qualified and can be in the United States legally. So let me help him. So he decided to sign my paperwork, and he. So I got into a private practice. Now, when I started uh, progressing this practice, so I decided I want to have a second one. So at that time, I had a cousin who was working with me, helping me out part time. Um, and then with him we went from a first practice to three practices. So his name is Tausif, and he is the vice president of operations and uh, deliveries in the India office. So he's
Okay.
handling everything over there. He's the vice president of my company, and he's my partner. So Tausif was, uh, he had to go back to India at that time, and because of his health reasons, and his mother was suffering. So he started that thing over there with our knowledge and with all the resources we had. We hired like seven people. Then in that particular year, I saw a lot of profit. I discussed it amongst my friends in study clubs and stuff. So my friend said, okay, can you start a team for us there so that we can have same kind of profitability? I said, okay. So we hired five more people, and then other people learned about it. Then I thought, okay, let's market this. And then, long story short, we got to like 50, 75 people. And then we started experiencing that it's really hard to manage people over there. You know, people needed to be monitored. We needed to keep training them. We needed to do certain things properly so that our clients can still have a good experience. So I started to think about technology. I was like, okay, we need to build a technology where we can track everything. So Denttracks came into being. We built it on Zoho. There used to be a platform called Zoho,
Yes.
so we built the whole system on Zoho. It worked really well, but it had its own limitations because I couldn't do what I needed to do on Zoho. So we scrapped it all. We had the concept established. We scrapped it all, and then we started building from scratch. So one thing led to the other, and then we continuously kept building. And then what we built was really, really powerful. So Denttracks came into being, and I don't know if I can share my screen. I will show you as we go. Um,
Yes. Can share.
but then that's how Denttracks came into being. And then we just continued developing it. One thing led to other, and finally, what we created was a full ecosystem, and that ecosystem is what I call an ecosystem of different tools and technologies that are within one platform, which helps people not have to have multiple logins, which helps people to stay on track with just a single login, even if they have multiple practices. And it
Yeah.
tracks the business operations for them. It's an operational tool. It is not a patient management software. It is something that sits on top of a patient management software. It becomes the central nervous system of the business operation, and it helps people understand all the KPIs, and they understand what's going on with their practice, the pulse and the heartbeat of their practice, and that helps them to really hone down on the business operations and make it powerful. So that's how Denttracks came into existence.
I think so. Denttracks came as an adjunct to your BPO solutions.
Yes, it came in as an adjunct. So it's like a single login. You log in. Once you log in, it takes you to the whole dashboard. So here you can see these are all the tools that I've built over the years, which helps a practice run through the whole patient journey. It begins with when the patient makes the first phone call. So the patient is able to receive that phone call from a voice AI agent. So we've created voice AI in there, so patient can talk to the voice AI. If they want to talk to a live agent, the AI agent can transfer the call to a live agent within the office. So once the patient's conversation is going on with the agent, it's able to send the links to the patient to fill out the forms, send the payment links. Once the forms are filled out, then it runs an eligibility verification. So everything in the United States is based on insurances. I don't know how it is in Saudi Arabia now. Is
No,
Are
it is.
insurances coming into being now?
It is most important to have insurance here now. Without insurance, your bill will be doubled.
Okay, okay. So the insurances all are already in there. So I need to
Yes.
start talking to you more on the professional side so we can take this platform to Saudi Arabia too. Because
Yeah.
wherever there is insurance, you can actually have a lot of things done with Denttracks. So the insurance eligibility verification happens here, and now everything is ready for the patient to come in. So once the patient comes in, the work is performed, and then our tool will be able to create a claim in an automated way, or the biller can create a claim with the help of the tool. The claim gets sent to the insurance company, and then our system tracks the claim, and then that claim is adjudicated. The money comes into the office in the form of a check or in the form of a payment directly into the bank. So I have an accounting software here that manages the whole reconciliation between the patient management software. I don't know which kind of patient management softwares you guys use in Saudi Arabia.
No, I have no idea.
Okay, so the patient management software is where all the information of the patient is saved. It's a digital system. It's Dentrix, Open Dental, EagleSoft, Denticon, Dentrix Ascend. All these are different platforms that offices use here in the United States. I think in Gulf areas, in GCC countries, there is Dentrix. I think Dentrix is the major player, and it's entering into that market. But we sit on top of that. So we extract the data from the patient management software, and then that data is utilized to flow it into our platform, and our platform makes that data more meaningful, and it puts it into different places where it's required. So once the accounting is done, say the
Mm.
claim is not fully paid, then
Okay.
it goes into something called as revenue cycle management, which is DentRev, and partially paid claims are handled there. There is denial management system, why the claim was denied, whether they need extra X-ray, they need a narrative, they need the doctor's notes, they need perio charting, they need a picture of the pathology, whatever the reason is. They will send you
Mm.
information in the form of something called as explanation of benefits, and then
Okay.
some our system will read the explanation of benefits and puts the notes for the billers, or
Okay.
somebody which is human in the loop. It is called human in the loop whenever you're dealing with AI. If
Mm.
the AI fails somewhere, that edge case is picked up, that failure is picked up by the human expert, and then the
Mm.
human expert deals with that part, and then it basically logs in, labels that exception, what happened, and then that same thing is fed back into the learning loop, so the system can learn itself. So then when the system learns itself,
Next time
when
it.
that same yeah when that same thing comes up again to the system, now it has learned it. Now it can solve it. Sometimes it will need training 2 or 3 times, and then
Mm.
it learns that exception, and now it's no more an exception. So now the human is free from dealing with that issue again. So that's what we are doing a lot right now. So once that happens, you get your claim paid, and then we have a cool system here which is called Dent Comply. So Dent Comply is a compliance management tool where you're able to manage the compliance related to the doctors, to the
Mm.
employees, dental assistant, hygienists, and then you're able to manage the compliance related to the facility. Like, your facility needs to have proper exit plan in the case of fire. They need to have proper sterilization techniques. They need to have proper filters, backflow preventer valves, fire extinguishers, things like that. So everything related to the facility, we manage that within Dent Comply. And then we have a very big analytics tool which gives you information about the health of the business. We have about 250 different key performance indicators in there that help
Mm.
you run your business profitably. Then we have something called as Dencentive, which is a very futuristic, gamified plan for helping staff doing work in the office so that they're incentivized properly, and they can see it on their dashboard how much
Mm.
incentives and bonus they're making. It helps them stay in front of the social media
Mm.
as the representatives of the practice. Whatever
Mm.
they're doing on social media, they get points for that. Whatever they're doing for the business, they get points for that. If the business is profitable and it's running a profitable operation, then they
Mm.
get points for that, and then they can make additional bonuses. So that's a very gamified plan that we have created. And then we have DentAuth, which is a very cool tool that helps offices keep track of their ortho patients. Because in patient management softwares, this
Mm.
is a big problem. So if the patient is coming to you for regular work and they're
Mm.
coming to you for ortho, because ortho is monthly, they're paying monthly, and the
Mm.
ledger gets really disturbed because of that. And then you're not able to figure out which money is pending from other procedures versus which money is pending from ortho. So we have created that tool to solve that pain point. And
Okay.
I'm continuing to develop this ecosystem more and
Mm.
more. Like, as we go, I'm finding complementary technologies. Like right now, I'm working on inventory management,
Mm.
which is a tool to help offices manage their inventory, and that's going to be really awesome with AI and everything. So just giving you a snapshot of what I did with
Mm.
technology. I didn't want to make this digressed into a technology discussion, but just wanted to show you that. I can stop sharing if you want me to.
No, it's okay. I think it's wonderful. You have covered everything regarding the complete management of a practice. One thing I felt missing is marketing.
No, it is. There is marketing. There is marketing. So the piece that I told you about the patient engagement. So that patient engagement tool is linked to marketing. So what we do is, when we do an onboarding for a client,
Hmm.
we go in and we capture everything that they're doing for marketing. And
Okay.
for example, they are running their websites and they're doing organic marketing there. They have Google business pages, they have Instagram, they have Meta. So we capture all of that information and we bring it all, every single lead that's coming from any marketing source, we bring
Okay.
it all into our marketing funnel on Dentcom. And
I
then we
think
are able to show you a complete ROI. We are able to
yes.
show you which marketing is working for you, which is not. We are able to not only handle the external marketing, we are able to
Hmm.
handle internal marketing in the tool too. Which means if the
Okay.
patient comes to your office for an exam,
Hmm.
the treatment plan was made for them, but they said, okay, I'm going to go back, talk to my husband, and then call you back. Well, they
Hmm.
forgot about it. So our tool
Okay.
catches all of that, lays it down in a proper listing form, and is able to assign to an AI agent. You're able to assign it to a live agent, and then somebody can work on that and then bring that patient back. So that's called internal marketing. So the patient already came to you, and somebody needs to work on that patient, whether it's recall list, whether it's unscheduled treatment list, whether it's a list that's created for inactive patients or patients that have had an exam done and we've put in like image processing AI on it. The
Hmm.
doctor missed a cavity, but the
Hmm.
AI caught the cavity, so that those are potential patients. So we catch all of that too. So it's very advanced. So it's not just external marketing, it's internal marketing too. So I went through all these pains, Dr. Zaidi. So me being a clinician operator, I
Hmm.
call myself a clinician operator, and most of the people in the United States that are practicing are clinician operators. So we are within the four walls of our office, and we don't
Hmm.
have the time to look at all of these things related to the business. So we always have leaky buckets. So we
Yes.
have a lot of time spent on managing the patient care, and we don't have a lot of time left for managing the business. So
Yes.
we create leaky buckets for ourselves where the water is spilling and leaking out from
Hmm.
various different ways. So what I try to do in Denttracks is I try to plug that leaky bucket so that a clinician operator, even if they put in 15 minutes every day to be
Hmm.
able to look at the business and which is in their hands, they can log in from anywhere. It's cloud based, so they can prevent that leaky bucket, and then they can put that money back into their pockets. This is my passion. So I mean, I can really sell this to DSOs, and the DSOs can come in and have 50 practices and they want my tool, but my passion resides in helping people like myself who suffered at the hands of whoever, whether it's administrators, executive consultants. Everybody is trying to give us advice, but nobody is actually helping us execute it, right? So what I built is an execution tool. I don't want to just show you all the key performance indicators and tell you that you have a leaky bucket here, you have $500,000 sitting in your accounts receivables, but who's
Hmm.
going to work that? I've created a tool which will work for you. Like, it'll bring that money back into your bucket, because we have AI orchestration layer on top of it that actually does the work. So even if you don't have the people to work on your accounts receivables, well, my system will work on your accounts receivables, and we have human in the loop. We have the pods, point
Hmm.
of delivery of services piece that we can provide you, so you don't have to hire a $4,000 employee to do it. You can hire an employee from us at $1,000,
Hmm.
and we will still be able to provide you with the same level of care in your business that will help you save that cost of $3,000, at the
Hmm.
same time bring all that money back to you. So this is the model. This is my mode.
I think I haven't seen anything like this till now. Like most of them, like one is I saw every part of it into a different company. I saw this.
So that is the issue, right? So my mode that I told you, the mode
Hmm.
is that we are providing you with an actual work delivered That is
Yes.
one mode. The second mode is I'm not a point solution. So those solutions you're talking about, they're point solutions. They solve one problem. But then practices are tired of these point solutions, because what happens with point solutions is there are overlapping features. So if one solution has one problem they're solving and you like another solution that's solving another problem, okay, you like these two solutions, but within them they have like a lot of other things that are overlapping features. So you don't want overlapping features, they clash with each other. And the most important thing is the data that's sitting in one point solution and the data sitting in another point solution, that doesn't talk to each other. So they are
Yes.
siloed technologies, they are within their own boxes. So to give you an example, if you have a solution, say for marketing that I explained to you, and you have a solution for claim submission, for example, right? Now, the data sitting in both of them is not talking. Now, if you have a patient that came in um, to provide to your office to get the work done, they have an insurance. Now that marketing solution is not able to solve that insurance thing. It's not even, it's capturing that information, it's not able to transmit that information to a insurance claim submission solution. Now when you're on the claim submission solution, you're having to do data entry again, right? If the data entry is done wrong here and wrong over there, I mean, humans make errors, it always happens. In my solution you never have to do a data entry. We capture all that information from the PMS. It's entered correctly in the PMS. It will flow into all my solutions seamlessly. If there is an error in the PMS, we try to solve that too, because when the patient comes to our solution first, the patient is doing the data entry, and then we push it back into the PMS. The patient is scanning the insurance card, they're scanning their ID or their Iqama, whatever. When they scan it, our solution reads that information and it pushes it back into the patient management software directly from a government issued ID, which is always correct.
Yes. So why didn't you add the patient management system also in it? Because it's covering everything of a practice. Just why leave
Yes,
that
that's a
out?
good that's a good question. And the problem is that, these big patient management solutions that are already there, they are too big. They capture a lot of market, and I don't want to compete with them. I want to work with them as a partner so that I can sit on top of them. So that model, that business model makes me more viable. So I'm partners with all the big patient management softwares now.
Okay.
So now they are working with me and they're promoting me to their clients. So it creates a seamless journey for my platform to be adopted easily. Now take for instance a market like GCC. In GCC market, patient management softwares are just launching. So that market will be an ideal. I have a patient management software too.
Okay.
My patient management software is used in India. It's called CAPS 28.
Caps 28.
Okay,
Okay.
so you can
Okay.
look it up. So I have a patient management software. It's not a part of Denttracks here in the United States, but if I launch in GCC, I'll launch it with the patient management software.
Yeah. I think in
So
GCC it will be a much better thing.
yes, because in GCC, Dentrix and Open Dental and EagleSoft, all these big platforms that are in the US, they are not available in GCC countries, right? I mean, they are available, but they haven't captured that full market yet. So when I launch, I can launch with the full package.
Are
You're
you
right.
planning to launch in GCC?
I'm in talks. I'm in talks with a lot of people in GCC countries. I'm actually trying to get certified by NABID. You know NABID, right? NABID is the platform that uses the patient health information, and that patient health information is supposed to be uh, very very secret and sacred, like it is here in the US. It's called HIPAA. In
Yes.
GCC countries, it's called NABID. So we are trying to get NABID compliant. Once we are able to do that, then we will start our process. So we're in the process of doing something in that regard.
Okay. Uh, because they take patient records very seriously here. It's not like in
Exactly.
India. Yes.
Exactly. exactly. So it's very important to do that, because patient's health information should be something that should be only known to the patient, or whoever the patient decides that it be known. So I think these rules are coming hopefully in India too. You know, the privacy of the patient is important. So as these things come up, it becomes more and more important for platform like Denttracks to be adopted. It's very, 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 very important for things like that to happen as we go.
So you said that the Dentrax has 250 KPIs, but dentists can get confused among all this also. So
Yeah.
can you send five KPIs, which if a dentist tracks will it will tell them almost everything they need to know about the health of their business.
Yeah. So, I mean, see, every operator is different, right? So
Hmm.
there are certain things in a business that you should not take for granted, right? I mean, I always tell clinicians and people who just graduate, I
Hmm.
mentor, I educate people. This is my passion now.
Okay.
So I always tell them, if somebody comes over and tells you that, you went to dental school to be a dentist, and you know how to do certain things, and you're really good with that, and that is dentistry. Let
Hmm.
us take care of your business. We've gone to business school and we have learned business, so let us take care of your business. There's nothing wrong with that, but when they say that, that to me is a cliche, and I really tell my dentist friends and colleagues to not fall for that,
Hmm.
because this is your business. If you're not taking care of your business, then whoever is taking care of your business, sometime or the other, you will feel that you're screwed over. So it's
Hmm.
not a good idea. So learn the business, even if it means learning it 15 minutes every day. If you're working for somebody as an associate, look at your day sheet. At the end of the day, look at the sheet that your patient management software spits out,
Hmm.
and it gives you details of what you did. So patient that you saw, Mr. Smith, whatever you did for that patient, it's enumerated there. You look at each line item, you approve it, you make sure that the billing is done for only those procedures, because it's
Okay.
your license on the line. If
Hmm.
somebody is billing wrongfully, the authorities won't come back and catch that person. They'll say, you are the dentist, you are the licensed dentist. What were you
Okay.
doing? Why were you not watching? Right? Plus, if they missed out on something, you lost that money if it's not on the claim.
Okay.
So that's where business starts. So at the end of the day, look at your day sheet, how much you produced, and then
Hmm.
the claims have been created for all the 15 patients that you saw. Why
Hmm.
is the claim not created for these two patients? Or they're cash patients. Okay, was the cash collected for them? Okay, it
Okay.
was collected. So I mean, those are the things you look at as an associate. As a
Hmm.
business owner, you need to look at things like, okay, how much production was done today on patients, how much was collected today, whether all the claims that were supposed to be sent out were sent out, what is
Hmm.
the status of those claims, like if they were sent out, did they get kicked back from the clearinghouse?
Hmm.
um, Claims get kicked back sometimes because there is wrong information. The social security is missing, the date of birth is missing, the subscriber ID is missing. If
Okay.
people are not paying attention to what they are supposed to do, the claims get kicked back. And if somebody is not reading the reports, not going through the reports, then that claim is sitting in your system as unsent claim,
Hmm.
and your manager is thinking that they've already sent it. Now there's something
Okay.
called as timely filing limits in the insurance industry. So insurance gives you certain specific amount of time to file your claim. If
Okay.
your claim is not filed within that time, your
Hmm.
claim is denied automatically. So if you send the claim out after, say, whatever, 90 days, and it's not filed, you send the claim
Hmm.
afterwards, it's like it's beyond timely filing limit. So you need to
Hmm.
look at that. So it's very, very important. In a daily routine, these things get missed. And
Yes.
you're seeing 15, 20 patients every day. If you did
Hmm.
not look at this today, tomorrow it's 30. Day after
Hmm.
tomorrow, it's 45. When it
Okay.
gets to 50, it's very difficult to see it altogether, right? So do it every day. So these are the things you can look at. You can look at You know how much, whether the money that's coming into your bank is matching with what is being posted in your system, right? So if you have $100 in the bank and in your system $120 are posted in your PMS, right? What happened to the remaining $20?
Okay.
Right? You got to be able to figure out what happened to that $20. So if you go back to your manager and you tell them, oh, I only received $100 in the bank for this day, you know, bank will not receive the money right away, right? I mean, there's credit card will settle in about 3 days, 2 days time. So you can go back and you can look for the previous week, right? You have to know what to do when you're checking different things. Production collection same day, account reconciliation previous week or previous month, but you have to have a plan for everything. So if you're looking previous week and you're seeing that, okay, it didn't match, then you can go to your manager and tell them, I want you to figure out why it didn't match. Then your manager knows that, you know, my doctor is watching. Then they will not do anything funky. If they know that, you know, the doctor is watching, then they will be discouraged from doing anything funky, right? But if nobody is watching, people get an opportunity
Yes.
to do embezzlement, and things start happening in the practice. You don't have any visibility of what's going on with your data. So you know, these are some of the things. It's a completely different lecture, completely different session to be able to determine all of the KPIs. But every KPI has its own value. It has its own merit, whether it's related to your marketing, whether it's related to your credentialing, whether it's related to your compliance, it's related to your profitability, it's related to your, RCM, the whole RCM, revenue cycle management system. All of those have their own merits. And, you know, there are staff members within an office that deal with certain things. They should have proper assignment of roles. You know, you should have everything written down. Your procedures and policy manuals for your office have to be written down. Everybody should know what their roles and responsibilities are, and that's what you're tracking. So it's a you have to run your business like a business rather than, something that is just running on its own.
Yes. But most of the dentists, there is something called burnout or their lack of time. But how do they find so much time, to look at it daily?
Yeah, so like I said, 10 minutes. If you're spending 8 hours taking care of your patients, right?
1 hour for the clinic.
Then spending 15 minutes to make sure that the work that you perform will be paid to you is a
Yes.
no-brainer.
Yes.
So do not spend 8 hours seeing your patients. Spend 7 hours seeing your patients. But if you are not spending that 15 minutes to 1 hour, depending on what all you want to look at, you are wasting your 7 hours. If you're not
Yes.
wasting your 7 hours, maybe you're wasting 2 hours out of that because you're not going to be paid, right? I mean, every society is different. For example, maybe in Saudi Arabia, it's different. In India, it's completely different. In India, it's cash based economy, right? So everybody comes in and they pay, right? They cannot leave without paying. It's cash, credit card, and stuff like that. But now the systems of insurance are coming in. And as systems of insurances come in, getting paid becomes more and more complicated. So that is why it's important to learn the business. I mean, even if you're getting paid every day, there is a chance for cash embezzlement. How are you watching cash embezzlement? What are your checks and balances for making sure there is no cash embezzlement? So you have to figure out a plan. In Denttracks, we have created a cash management system within Dent accounts. If you
Okay.
follow the system properly, you will never have cash embezzlement. So I'm giving a lecture on the 1st of May here in Houston at an event called Dental Next, hosted by Process. And I'm talking about operational excellence in a dental office. So I'm going to cover these subjects. Right after my talk, there is a talk by Mr. David Harris. He is an authority on embezzlement, on fraud in a dental office. His company is called Prosperident, and then he only talks about forensic accounting and how people lose money in a dental office and how fraud happens. So it's going to be a great workshop. I'm looking forward to it. But Mr. David Harris and I had a conversation, and when I showed him my platform, he was like, if people start using Dent accounts from here, they will have absolutely zero chances of having embezzlement in the office. And he wants to be an advisor for Denttracks. So that's great. So that's how I'm expanding my advisor ecosystem as people are learning about it and they want to join the revolution. So I just started doing this, I mean, about a year ago when I decided I want to take it out in the market. I was making this for only myself. And I did not even have any idea that there's something called as SaaS, software as a service. I
Okay.
met with somebody through my father-in-law who was an ex-Microsoft. He retired from a very senior position in Microsoft. And when he saw what I built, he was like, "What are you doing? I mean, this is crazy. You need to take it out to the general public in dentistry, all dental offices." So
I think
that's
Mirza Arafat Beg, I think your partner you're talking
so
about.
Mirza Arafat Beg is my operations manager, but Mr. Ghazi,
Mr. Raj.
Mr. Nasrullah Ghazi is my mentor. He's an advisor for the company, and
Okay.
he's taught me a lot of things about technology and how that technology should be used and propagated. So I've completely changed my role. I am not doing clinical dentistry anymore.
Okay.
I'm not chairside as much at all. I just took myself away from that, and I've generated this renewed passion of doing something in the technology space and helping my colleagues that way. So far my career has been about helping patients and helping people that I touched. Now I want
Nice.
to pursue the route of helping my colleagues and giving these tools in their hands for them to be able to run their businesses effectively. I mean, I've had a couple of incidences while I was building my practices, which really affected me. Within my 12 offices, I have 20 offices
Okay.
because I did some mergers and acquisitions. So if I have an office close to my office that is the dentist wants to retire or dentist wants to close their office, if I learn about it, I go there, I talk to them, and I say, okay, let's merge our operations, and then
Okay.
come work for me, work with me. So I've had two incidences like that. Two lady dentists. When I spoke with them, and I looked at the health of their practice, I ran an analytics and I evaluated their practices. So I do a very thorough job at that. I do some
Okay.
practice consulting too in that respect. Uh, and when I told one lady that, sorry to say, but you lost $1.2 million in last 5 years in your practice, uh, she was in tears. She was absolutely in tears, and she was like, "Dr. Yar Khan, I cannot tell you if this $1.2 million were in my account, I would not be selling my practice. I would not be in this financial strain and situation that I'm in right now." She was in tears. She was like, "Please take the key of my office, and I don't want to come here anymore." Um, so I worked with her, and then I absorbed her as my associate, and she's happy now. But there was another lady who lost $600,000 in 3 years' time, and then she was in tears. So I was like, I mean, really, this is a very prevalent problem in the dental circles where people get burnt out because they're working so hard and they're not focusing on their business. So I just felt like, I got to do something about that. And
Yeah.
everybody is talking about DSOs and money and money and money. I was like, okay, these are clinicians. These are like my colleagues who do excellent work. Some of these people, if you look at their endo, molar endo, you cannot find a fault with their endo because it's so beautiful. And they're not even an endodontist. If you look at their crown fits and margins, beautiful work. When you look at their practice health, it's failing. So these are the people who are connected with their patient. They spend so much time with their patients because that's their passion. They want to help their patients. And then at the end of the day, they are getting screwed over because insurances don't want to pay them. Their office managers are not honest. Somebody who's a consultant who's saying that they're trying to help them are only filling their own pockets. I feel bad for them because these are the people that need to stay in business so that they can continue to help the patients. So what I decided was, okay, I'm helping one patient. If I help a doctor,
You're
I'm
helping
helping
others.
I'm helping keeping that doctor in business because that's such a good doctor, and he's helping 100 other patients. So that way I'm indirectly helping 100 patients. So that renewed my vigor to do this. And then I'm just full time doing this, and I want to put it in the hands of as many dentists as I can put it in the hands of.
I think you are the best person to do it, having run so many clinics by your own, like having a small DSO of your own. You know the ins and outs of the business. Scaling from 1 to 12 or 20 is not a small feat. So I think you are the best person to run this.
Well, I mean, yeah, I'm learning, and I'm learning as I go. I learn as I go. I try to, learn from people like you, people who interview me. I'm around a lot of colleagues and associates and personnel that I'm seeing. um, all of these people, have taught me something. I mean, Denttracks did not came into being, and it's not just my brainchild. Like, I have 15 office managers in my office. Every one of them is a star, and I'm indebted to them to give me all the feedback that they give me. Lots of practices that were on beta testing for my platform. I'm indebted to them, my colleagues that have given me constructive feedback and stuff like that. That's why, I'm doing a capital raise right now for the investment opportunity that I want to give in the hands of these people who helped me. So I valued my platform at a lower valuation right now, and I'm giving out shares of my practice in the form of not practice of the platform in the form of safe agreements, which are simple agreements for future equity when we do a proper Series A round. So all these people who will invest now will come into the platform at a very, very small amount, and then this is what will make the business grow eventually. And then when the business grows and it becomes bigger, then we will have a better opportunity for them to make up their money, because now they are getting exited from the business, or they can roll in their money at a much higher valuation. So I'm going to show you a couple of slides of the offerings that we have. Yeah, but yeah, if you have any other questions, just in the meantime, go ahead.
I was asking what is the retention rate, like people who are practices have already on board with Gentrax. What has been the retention rate of it?
Well, I mean, the retention rate is high. I mean, we are not in a lot of practices right now.
Hmm.
So uh, the retention rate is 100% right now. We're not in a lot of practices. What we are doing right now is not something where we are onboarding a lot of clients. That is the
Okay.
whole reason I'm raising
Still in
funds right
the
now.
beta phase. Yeah. Okay.
Yes, we are raising the funds right now just because we want to have. No, it's not in a beta phase. The product is completely made. But like I
Hmm.
said, I have a really big back office team, and I have
Yes.
a big team of professionals who are working with me on the product. But I don't have a big sales marketing, and I don't have a big support and maintenance team. So this is what we are trying to build right now. So for me to be able to hire a
Hmm.
good sales and marketing team, I'm going to have some money. I've already spent a lot of money in building this. So I thought, okay, let me give this opportunity to people who are wanting to get onboarded
Okay.
and want to invest. They want to be on the platform. And then with that money, I'm going to do a little bit of reorganization and create the sales and marketing team. So I'm already going to conferences and delivering lectures, but I'm not good with sales. I'm not a salesperson. So I want to hire that sales and marketing team so that they can set up booths in conferences, and then they can set up events, and they can set up meetings with different clients, prospective clients, and DSOs, to have conversations with them, go over the demos with them, and then get that sales in. So this is what I want to do once I have this capital raise offering closed, I'm already talking to a lot of people to not only raise the capital, but also people to join the ecosystem of my advisors and people to be hired on the sales side and the revenue side. So this is what the money is going to be used for, and I'm looking forward to having that done in a way where people can onboard at the early stages so that they can have a good return on their investment.
Actually, my next question was, Jared, how will you be using your money, your capital? I guess you
Yeah.
answered it.
Yeah, so the funds will be used. This will be like, for 75% of the funds will be used for sales, marketing, and operational needs, and then 25% for sustained engineering and building AI orchestration layer. Yes.
So, what does next 5 years going to look like for Denttracks? Is it market dominance in US or global expansion?
Yeah, so we want to capture the market in the US, but US market is big. There are already players in the US market. I have not seen any platform as comprehensive as what Dentrax is.
Yes.
But if even if I target only 2% of the TAM, so the TAM is about $5 billion, and then if I target only 2%, there are 200,000 offices in the United States. 2% of that is a good number. 200,000, 2% is like
Four.
almost 4,000 clients, right? 4,000 clients. Uh, I will be at a revenue of close to like 57 million, and then that will really transform into a great exit at that time. But I don't want to think about exit at the moment, because SaaS companies get valued at 10 times, 12
Yes.
times, 13 times their revenue. So I just want to build at the moment. So this is also driving me. I mean, out of 200,000 customers, I only want to acquire 4,000 customers, for example, right? Even if I'm able to do that, the company health will be awesome. I'm looking forward to that. In the next 6 months, I'm going to onboard about 300 to 500 clients, because I have a pipeline of about 175 people who want to onboard, but I'm delaying it just because I want to give them excellent customer service. I want to make sure that if something breaks, after all, it's a technology,
Yes.
people can get help right away, because I understand how dental offices function. If something
Yes.
breaks down in a dental office, then it can cause a cascading effect. So I don't want to spoil my name, don't want to spoil the name of Dentrack. So I want to do it the right way. So that is the reason I want to just take it easy, make sure that everything is in place, the team is in place, and then I do it. So that's why we're doing this capital raise.
I think having your dental BPO also gives you an edge over other offices because you have a deep operational understanding of the back office as well. And I don't
Exactly.
think anyone else can replicate it like who are beginning now, but I don't know about the major players. I think it gives you a different edge for you having that team.
Yeah. So the thing is, see, in the US, it's not just the clinicians who are making these technologies. People have understood that dentistry is a great business, and the private equity, the venture capitalists, the technologists are coming into this field. So it's the
Yes.
technologists who are building this technology. The edge that I have, you're right. I'm the clinician. I
Yes.
know what the pain points are. I have solved those pain points in Dentracks, and I continue to see some problems that I'm going to continue to solve. So that is a great mix. So I'm the subject matter expert, I'm the technologist, and I'm the clinician. So this is where I think I'm different from others. But at the same time, the market is moving really fast, and I'm moving at a little bit of a slower pace, just because I want to do it the right way. So it is what it is. But eventually, I'm seeing a lot of traction now, that I'm on the speaking circuit. I'm talking to people. I'm getting invited to conferences to talk on the subject of AI in dentistry, operations in dentistry. So all of this that I've learned over the years, I'm putting down on pitch decks and slide decks, and I'm trying to explain it to people and educate them. This is my passion, and I think Denttracks will just fall in place eventually. People will learn about it, and we will just have a proper team to manage that.
So you were showing the how they can fund
Yeah,
the dental.
actually, I'm not able to pull up that particular slide, but on my LinkedIn, I've been able to put some information. So what we are doing is we are raising capital on Angel List. Angel List is a great platform. People can actually go in there and they can sign up. What I can do probably is I should be able to pull up something for you in the form of a QR code. So if people can scan the QR code, they will be able to sign up uh, with the Angel List, and then once they sign up with the Angel List, they are able to go into something called as the data room, and the data room will allow them to invest if they're ready to invest. So let me
I think what is the
pull up.
minimum investment you are looking for?
Yeah, so what I have done is I've made a really good plan for the dentists. So the dentists, if they invest in combo, the minimum investment to answer your question is $10,000. And then if they do a combo, if they want to become an investor and they want to use the platform, what we are doing is the platform fee by itself as a full suite is $800. We are reducing that to $499 for them, and then we are waiving off the implementation fee completely.
Okay.
So what that does is it saves them $5,000 in a whole year. So this will allow them to be invested with just only $5,000 if you look at it, and then it will also allow you to become the user, so you can give more feedback, constructive feedback, and then help you become investors too. So
Are
let
you
me
in Canada as well?
yeah, so we like I said, we can definitely cater to clients wherever they are, as long as they have a patient management software. So this is the beauty of what I've built.
So one book every dental practice owner should read that has nothing to do with dentistry.
I liked Animal Farm
Animal Farm.
by George Orwell.
Okay. The one metric a dental practice should obsess over above all others.
Collection numbers.
Is it AI and hype or it really helps the practice?
Lots of shining objects out there. True AI should be differentiated from something that is a shiny object. But there are lots of good tools available out there.
So if you could give your younger self, fresh out of dental school, one piece of advice about business, what would it be?
I've always been an entrepreneur. I've been involved in the business myself all the time. I would say one piece of advice as an overall thing would be to, okay, uh, maybe take some more time out for myself.
I mean, running three companies at once must have cost you personally a lot. Was it worth it now at this stage?
Absolutely worth it. I mean, I have three kids. I spend a good amount of time with them. I have a wife of almost 25 years in marriage. My family has been very, very, very supportive of me. The testament of what we have done, and then what I've done with my family, is my son is interested in dentistry, and he's pursuing my oldest son. He's pursuing possible career in dentistry.
So, what's your message to every dental practice owner who is still running their business old school?
Well, it's a great profession to be in. It gives you a lot of satisfaction. It's a lot of instant gratification that you get. Running a business can be a hard thing, but I mean, it's not a rocket science. If you are able to do a root canal on a molar, That to me is a rocket science. That is harder than actually learning the business side. And when you learn the business side, it becomes easy. So don't shy away from learning the business side. Don't shy away from numbers. Don't shy away from learning how to create spreadsheets. Looking at the spreadsheets, make sense out of the numbers. Then it becomes really easy. Business is really easy.
And Dr. Khan, this has been a genuinely refreshing conversation. Where you have built an entire ecosystem of a practice right from the patient's call to, dentist well-being as well, if I may say. I hope, for anyone listening who owns a practice and is wondering where to start, I hope that what you have to do today makes it feel little less overwhelming and little more possible.
Well, I think if I can do it, anybody can do it. It's I'm not a very brainy person. I work hard, so and I always tell people that there is no substitute to hard work. But work smarter. Make sure that you have time for yourself and your family. Learning the skill of dentistry is very, very difficult. Once you have learned it, continue to advance your career, keep learning new things. Don't shy away from learning about implants or cosmetic dentistry or all on fours, all on X's. This is the future of dentistry. And then don't shy away from adopting technology, because if you are not going to adopt technology, somebody else will, and they will look brighter than you are. So make sure that follow that dream, and then remember, every outstanding success is based on the ability to do better than just good enough.
Well said, Dr. Khan. Thank you. Thank you so much for your time and building such an important solution, which is helping dentists ease their stress. Thank you so much.
It was a pleasure to be on your podcast, and thank you to all the listeners.
Thank you.